Before a fever breaks or a cough begins, the human body is already sounding the alarm. At the cellular level, microscopic shifts in our biology broadcast continuous warnings that an illness is taking hold. For centuries of medical history, these signals have gone completely unheard. We simply have not possessed a tool sensitive enough to listen to this internal language. Because we cannot hear these early whispers, modern healthcare is locked into a cycle of reactive response. We wait for a macroscopic system failure, a severe infection, a cardiac event, or a physical collapse before the medical system begins to intervene. Traditional medicine relies on a snapshot system. A patient visits a clinic once or twice a year, providing a physician with a brief, isolated moment to assess a living, constantly changing organism. This timeline graph shows a typical year in a patient's life. Our understanding of their health currently rests on a single data point, one blood pressure reading or one heart rate check, leaving the other 364 days of biological activity completely unaccounted for. In the dark space between these isolated appointments, diseases silently take root and progress. They develop entirely undetected by a system that only gathers data when the patient is sitting in an exam room. Eliminating these blind spots requires recording a continuous film of human biometrics, capturing the subtle biological transitions that occur between every clinical snapshot. Transitioning from rare clinical checkups to a constant 24/7 health record provides the necessary data to move medicine into a state of proactive prevention. The modern smartband acts as the primary hardware for this continuous record, functioning as a biological microphone that listens to the body's internal rhythms 24 hours a day. These devices rely on optical sensors. By emitting targeted pulses of light that penetrate the skin, the sensor measures reflection off moving red blood cells to track continuous blood flow. This continuous stream of light captures a steady flow of foundational health metrics, including heart rate, blood oxygen saturation, and microscopic fluctuations in body temperature. By analyzing the precise time intervals between each heartbeat, these sensors measure heart rate variability. This metric provides a direct window into the autonomic nervous system, revealing the physiological stress the body is enduring at any given moment. At night, micro-movement sensors map the physical shifts of the body, plotting out critical restorative sleep cycles with a level of detail that previously required a clinical laboratory. The medical utility emerges from the aggregate, a massive, uninterrupted database that defines a specific, unique biological baseline for every individual. Capturing this continuous film creates an immediate bottleneck. A single smartband generates hundreds of thousands of data points a week, creating a volume of information that exceeds human capacity to review. Artificial intelligence serves as the necessary translator, filtering and interpreting this massive influx of biological noise. This scatterplot shows algorithms ingesting a chaotic jumble of daily metrics, organizing them into a clear baseline wave pattern. Once established, the AI scans for deviations. A human might dismiss a tiny drop as error, but the algorithm identifies it instantly as an anomaly. The system uses pattern recognition to compare these tiny biological deviations against millions of historical health records from other users. By matching these subtle biological shifts to established historical patterns, the algorithm can predict an incoming viral infection or a cardiac event days before the onset of physical symptoms. The software refines unmanageable raw data into targeted early warning signals, providing physicians with the precise context needed for effective intervention. These applications are already operating in the real world. Smartbands currently detect irregular heart rhythms, like atrial fibrillation, across massive segments of the general population. Continuous oxygen and movement tracking accurately maps sleep apnea events in patients' own beds, replacing the need for expensive overnight sleep studies in a clinic. This split infographic shows the divide between algorithmic anomaly detection on a wearable and a formal clinical physician diagnosis. The wearable acts as an early warning flare, alerting the patient to seek professional testing without serving as an absolute medical verdict. These devices function to narrow the gap between the moment an internal anomaly begins and the moment a certified physician intervenes. As algorithms advance, researchers are developing digital twins, a predictive, virtual model of your exact biology, updated in real time by your wearable data. In the near future, hospitals could use this digital twin to run simulations, testing how you will react to a specific treatment protocol virtually before prescribing a single physical pill. But this level of individualized medicine creates significant ethical friction. A continuous biological surveillance network raises urgent questions about data ownership, security, and the right to biological privacy. The ultimate barrier to this proactive medical future is no longer technological capability. It is the challenge of establishing algorithmic trust and ensuring this highly sensitive data remains protected from misuse. For thousands of years, human medicine operated in the dark, waiting for disease to strike before reacting. We are now moving toward a system of constant, personalized, algorithmic vigilance. Pairing a continuous biological record with the analytical depth of AI allows us to respond to the body's earliest whispers, shifting the medical focus from managing illness to maintaining health.